Hi, I'm Mary Pipino and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. As my viewers know, I really love this time of year because everybody is motivated to think about getting healthy and getting fit. I wanted to do something a little bit different, as I always try to do at the beginning of the year, because so many shows are already addressing we have to cut out the bad foods, we have to exercise more, what gym are you going to go to, what next piece of exercise equipment are you going to use? Well, we've got something really cutting edge. December 6th through 8th of 2013, I attended Dr. Michael Roizen, who chairs the Cleveland Clinic Wellness Institute's Integrative and Preventative Medicine Conference for 2013 that had the most cutting-edge information to date. He had some of the top physicians and top wellness experts in the country there, and it really was an informative 3 days. It was very intense, but very informative. There was so much medical information that I asked Dr. Michael Lileas to join me today so we can interpret some of the medical jargon into more meaningful data for you. I think you're going to find the show interesting, exciting, and hopefully you're going to get some real motivation to adopt a healthier and more fit lifestyle. Welcome to 2014. I welcome my dear friend and one of our country's finest doctors of internal medicine, probably in the world, Dr. Michael Lileas. Board-certified doctor of internal medicine, founding partner of Salem Internal Medicine, former associate professor of internal medicine at Neo-UCOM, and hospitalist at the Surgery Center at Southwoods Hospital. My dear friend, thank you.
Thank you for having me here.
And what our viewers don't know is all the time you have spent behind the scenes combing through the information that was obtained at the Integrative and Preventative Wellness Conference I attended in Vegas. I came back with a series of PowerPoint slides this big. Half of you understood them all. I think I understand about half and understand them a little bit better thanks to you in our prep. But I wanted to talk about, what are the wows of preventative and integrative medicine for 2014? And I think we're going to hit on some interesting things.
And I think we have to, get it to the point where we don't overwhelm the viewers with some of the information that we have. Yeah. Because some of that information is above us. It's just...
Above us, not above
right.
You.
Well, even above me in certain areas of this research, because a lot of it is research and evidence-based medicine, but some of it is opinions. And we have to try and dissect what are the opinions versus what's really good for the person. So hopefully we'll touch on that today.
And I'm so serious when I talk about you being seriously one of the best, because I think you have that gift. You're able to take this information and then translate it into what's meaningful, to the people, to what they can understand, and really put it into, help them put it into practice so it means something and can get some benefits out of it.
Well, I hope that's our goal for today, and that's why I even brought some of my notes so we can hopefully get it straight for people.
Yes.
And make it mean something to them.
Let's talk about, so I wanted to create the wows of wellness. So we narrowed it down to 4. There were many more in the package, but we'll talk. Correct. We only have time for 4 today. We may do another show on this. The wows of wellness, number 1, I think is balance is key. How do we achieve and maintain the right chemical balances for our bodies? And it's our lifestyle, right?
Absolutely, our lifestyle, and it starts with our lifestyle, our diet, and what we're going to do with that diet. There are a lot of people that are talking about here's what you need to eat, here's what you don't need to eat. And there are a lot of things that you have to kind of take into consideration, and like we had talked about, moderation is the key. Mm-hmm. So, for instance, if someone loves to eat red meat, mm-hmm. We're not saying you can't eat red meat, but you have to limit the portions of red meat. If you like carbohydrates, potatoes, pasta, things like that, We're not saying not to eat them, but limit them, especially if you're diabetic. Part of the big thing with carbohydrates is that they're broken down to simple sugars. When that simple sugar in your bloodstream is below 110, it's great for your heart. When that simple sugar is below 250, it's good for your brain. So those are the two things we have to kind of keep in mind when we talk about what is the right amount of food to eat when we're talking about fats. Most meals, when we're talking about a fatty meal, we're talking about 30 grams of fat. Now that's going to vary with what you're eating.
Unsaturated versus
Right.
unsaturated.
Is it saturated? Is it unsaturated? Is it fatty meat? Is it fatty foods from fish? You know, here's another wonderful thing about, I saw it written in some of the research we were doing about fats. What are the good fats? What are the bad fats? Well, the easy way to think about it is if it's got 4 legs, it's bad fat. Cows, pigs. If it's got 2 legs, it's better fat, chicken. And if it has no legs, it's the best fat you can get. Fish, nuts, avocados, things like that. So I think that, there are things we can eat that are still fatty things, but they're good for us.
And that's
so
the
balance.
wow.
That's
Absolutely.
the wow.
And the wow is now making people understand. They're going to say, what's so wow about changing our lifestyle? The wow is, you don't understand. We can really take control of the healthcare issue in this country by taking a little bit more control of what we eat, how we move, and balancing stress.
Absolutely.
The wow marker in our number 1 wow, inflammation, very, very critical. Why and what is it? And real quick, this isn't, we say it's cutting edge, but we listen to this, the information's out there. We don't want to listen to it and do what it takes. February 2004, cover of Time magazine, The Secret Killer, inflammation. The surprising link between inflammation and heart attacks, cancer, Alzheimer's, and other diseases. What you can do to fight it. And we're going to talk more about that. But talk about inflammation.
Well, I think the biggest thing with inflammation, and if you look, that's back 10 years ago.
Exactly.
10 years ago. And now it's just coming to the forefront of medicine, so to speak, today. And there are a lot of things we can do to reduce our inflammation, our stress. And we'll get to some of those things. But as far as the inflammatory markers go, there are a lot of inflammatory markers that we do in medicine. Some of them are not things that we will normally do in everyday medicine. You're not going to go to your doctor and say, draw my interleukin 6 level, draw my interleukin 1B level. I want to know what my tumor necrosis factor alpha is.
And now I'm going to stop you for a second because they talked so much about the interleukins and especially 6. Quick, what are, if give us a little overview.
These are cytokines, which are proteins.
What's a cytokine? Okay.
They're proteins, and they are markers of inflammation. Some of the cytokines are anti-inflammatory, some are pro-inflammatory.
They're produced in the body.
They're produced in the body by different cells, whether it's fat cells, T cells, T helper cells, gut cells. So a lot of different cells are producing these various cytokines.
And as we get a little more into this, what you eat and how you move and how you control stress definitely has an effect on these, correct?
About it. No question about it. One study that was done that was addressed in the inflammation that you and I reviewed talked about high-fat meals. And high-fat meals, 30 grams of fat or more, how they increased the levels of various circulating inflammatory cytokines. Interleukin 6, interleukin 8, interleukin 18, tumor necrosis factor alpha. These are all bad things if they're elevated on a regular basis.
And a high-fat meal triggers
these. One of the other things that high-fat meals trigger is the narrowing of the arterial wall. The one study they did, they measured the brachial artery, the artery in the arm here. And they put a blood pressure cuff and they narrowed it and they, caused if you blow up the blood pressure cuff, it will cause the artery to narrow and reduce the blood flow. Well, what they did was they took that artery, they gave people a high-fat meal and a low-fat meal, and they measured the diameter of that artery I think it was 1, 3, and 4 hours after the meal to see what the diameter of that artery. And the diameter of that artery decreased. And I believe the inflammatory response was 10%, 20%, and then back down to 8% of the narrowing of the artery. So in other words, it reduced the artery narrowing, but it came back.
So, but the artery, now, because this is where I think we want to go and talk about James Gandolfini. Because what happens is you have an artery, blood's flowing through. So if you eat a high-fat meal, it's going to constrict it and make it smaller.
Absolutely.
But it will come back. The
Mostly.
problem becomes you eat a lot of high-fat meals and you start to get these little deposits. And this opening starts narrowing that doesn't come back. It gets buildup. So it's getting smaller and smaller and smaller.
That's the key.
So now you eat a high-fat meal and you're already pretty plugged as it is. The opening is so small from the plaque that has built up around, or the fat, and it's built up. You eat that high-fat meal, now it starts to, like you say, you've got so much fat in your body that when it's going through, that's when, if it's too narrow, can't get through, and you can stroke or heart attack, right?
Exactly. And that, I think you touched on, that's the key right there. The key is, if you do this all the time, if you're always eating fatty meals, so what you're going to do with that artery is you're going to constrict it, and then it's going to go back. Then you're going to constrict it, and it's going to go back. And what happens is the lining of the artery walls, the endothelial cells, which is a single layer of cells that lines the inside of the artery. So think about like your bricks in your house, the mortar between the bricks that keeps the cells together. Well, if you crush that and then open it, and then crush it, open it, what happens to that mortar? The mortar gets loose. So now things can go in and out, change. And those things that go in and out, fat deposits, platelet deposits, cytokines, all these different things that can come in there and cause that artery to narrow, narrow, narrow. Now, you may have a 30 or a 40 or a 70% narrowing. You don't feel any symptoms, no symptoms whatsoever. But then you get that one fatty meal. Maybe you have a cigarette or something, afterwards, or an alcoholic beverage other than wine. And all of a sudden, that fatty deposit, along with the inflammation from your fatty meal, causes that artery to narrow a little bit more. And now maybe you went from 70 to 95, and maybe that's enough to cause a heart attack or a stroke. We think about what happened to James Gandolfini. He never had symptoms until after that fatty meal that he ate. So you wondered, is that what it caused? Can we prove it right now? I've seen articles where people have attempted to try, but I think the bottom line is that he probably had some narrowing of the artery from years, of maybe not eating the right stuff, maybe not exercising as much as he could because of his schedule. And these are just things we're kind of assuming that maybe happened. And then all of a sudden you go from a 30 to 70% narrowing to 100% blockage, and someone has a heart attack.
And you can have, in addition to lifestyle, you need to know your genetic propensity too, because if you've got genetics that already you may have, for example, in my dad's family, and I think it's carried more on the gentlemen than it is with the women, but their cardiovascular system after the age of 70 wasn't very good. My grandfather, my father, fortunately, they had some medical treatments that helped him through an abdominal aneurysm and then open heart a few years later, and he was able to pick up another 10 years. But I think you have to have a good lifestyle if you know you have a bad genetic propensity, and which he did, and that can pick you up, maybe 10 or 15 or 20 good or plus good years. So, it all comes together. Back to inflammation and markers. Talking about what we are, that's why I think blood pressure is a critical marker of understanding your health. You agree? And
Correct.
that's something that you need to pay attention to for some of the things we're talking about. Doesn't it give you somewhat of an idea of how good your vascular system is functioning?
Correct. And, you know, if you're someone who has what they call borderline high blood pressure, in other words, sometimes your numbers are a little too high and sometimes they're in the normal range or a little bit lower. Well, those people, you know, tend to kind of ignore the fact that if you watch the fatty deposits, the fatty meals, if you watch, and this is not for everybody who has high blood pressure, but certain people are responsive to sodium, salt, and certain people are responsive to exercise. Exercise has been shown, and this is exercise in moderation, to lower the blood pressure. So I think that we have to really kind of watch all of these different things that we have that we can change. And there are some things, like you mentioned, the genetics. We can't change that. We can't change who our parents were, who our relatives were. But we can change some of the things that are perhaps in our own body and
We
the
can
way
trigger
we
the
do
negative things, or we can accentuate the positive.
That's a very good thing.
And you know, everybody wants to look at that darn scale. I'm not saying it's not important, but I think about the things you should be looking at are, you know, about fitness. Are you fit? Not just your scale weight, your percentage of body fat,
Correct.
your cholesterol, your HDL, the good, your LDL, the bad. There again, if you've got a high LDL, which is the bad cholesterol, it could mean those arteries are starting to clog up, right?
Correct. And, you know, since you brought that up about the HDL, the LDL, one of the other critical markers that we had mentioned about inflammation, you know, we're not going to usually do interleukins. That you're not going to check those. It's just not feasible. It's not cost effective. But there's a high sensitivity C-reactive protein, which is a measure of inflammation. That's been shown to be elevated in people with heart disease. So if you try to keep that C-reactive protein normal or lower than normal, that's going to be another risk factor that you can reduce. That is associated with stress.
And we're going to talk big time about stress. You know, and I think we start to see a lot of these things manifest as we get, you know, into our 40s, then our 50s and our 60s, because it takes time for some of this to build up. And naturally, the body's ability to reproduce better cells is much better when we're younger, right?
Correct.
So it slows down as we get older. We have these negative things building up if we're not paying attention to our lifestyle. You know, the genetics working against you.
Correct.
All of it comes together. Let's talk about how we can achieve the goal of relaxation and the inflammatory reflex. The nervous system automatically regulates different things. Our inflammation regulates, like how our body works, our heart rate, our digestive system, involuntary systems that go on in our body, correct?
Right, that's our autonomic nervous system, the sympathetic and the parasympathetic. The sympathetic being the fight or flight, you know, when you're afraid of something, when something scares you, when something is very sudden and all of a sudden you're surprised. That's your sympathetic nervous system that kicks in real quick, raises your heart rate, raises your blood pressure, and gives you the epinephrine, the increased cortisol to run or stand there and fight. Once that system kicks in, parasympathetic kicks in, lowers your heart rate, lowers your blood pressure. In some people, if it does it too quickly, they have what they call a vagal response.
Moi, the queen, since
Absolutely.
I was little. I go, from when I was a little girl, if I would see a bad accident, I'd get really nervous. Now, if I would see something like, you know, somebody bleed, that's why I could never be in the medical profession. I literally, like, I get, you know, kind of like real sweaty, clammy, and I pass right out.
Right. And that's those two systems, okay? Sympathetic first is the yikes, and the parasympathetic is, oh boy.
Yeah.
So those are the things that happen to people when they have those kind of reactions.
And it's not necessarily a bad thing, right? It's putting the
No.
body back in, trying to get the body calm.
Right, and you know, you sort of have to know your body. You know, I told you before that I've seen guys 6'6", 250 pounds come in to get their blood drawn. They see a drop of blood and they pass right out. And it's that same factor that happens in there.
And I think, too, I've found myself, really and truly, since I do have a much healthier lifestyle now, and a couple times when it's happened to me, I'll feel it coming on to me, but like, you know, I'll start to take deep breaths, I'll cautiously talk myself through. I've prevented myself from passing out a couple of times.
That is a great segue into the next section. Okay,
Yes.
now we're talking about the relaxation response.
Yes.
And what could we do? You know, back in '82 when I was in medical school, I read the book The Relaxation Response by Herbert Benson. He was a physician at the Cleveland Clinic.
Used in this, yes, and
Okay.
which they used in this.
And I don't know exactly
seminar.
what the date was that he wrote this book, the original copy of it, but I found that that was really something very unusual back in '82. And he talked about being able to lower your blood pressure and lower your heart rate to reduce stress. And if you think about it, you know, you're going to lower your heart rate so that you're taking your sympathetic nervous system and you're saying, whoa, just relax now. And so you're training yourself to be able to do that. And from some of the research that was in that seminar, they talked about yoga. They talked about being able to take your relaxation response to the next level. And they talked about the yoga masters being able to reduce their body's stress by lowering their heart rate, lowering their blood pressure, and causing this inflammatory response to go down. Because as your heart rate goes up and as your blood pressure goes up, these inflammatory markers, the ones that we don't usually measure, the interleukins, the cytokines, you know, go up and they cause problems. They cause damage to the cells. And that's what we need to do to be able to control those markers.
And it's amazing. And like you said, our next segue, wow, number 2, it is stress management is the number 1 factor. You have got to get under control because you're not going to, the 4 critical areas, the 4 factors that are causing the majority of our health problems, almost some of the worst in the world. Tobacco, bad food and beverage choices, physical inactivity, unmanaged stress. And until all the studies have pointed to, until you can manage the stress, you surely aren't going to quit smoking because you go smoke thinking you're stressed. You go eat because, well, I'm just going to eat. That makes me feel better. I'm stressed. I can't exercise. I'm too stressed. So until you get a hold of the stress, nothing else seems to be able to follow.
And that is really so correct. You know, all those 4 things that you talked about are all things that cause the chronic disease in America. And, you know, 75% of all the chronic disease that we see in physicians' offices, in hospitals, with admissions to the hospitals, are all based on those 4 things. And those 4 things are responsible for the cost of health care. The average amount of money that is spent per individual per year because of those markers is about $6,000 a year per person. Now just think if you can reduce that by half, you've reduced the healthcare budget substantially.
You would absolutely fit, like you said, you would fix the healthcare problem and you would fix our deficit. It's so much is driven by healthcare. You are absolutely correct. Studies are now proving that. Absolutely true. Let's talk about cortisol a little bit.
Okay.
Because it is part of this, you know, whole stress conversation. What is cortisol?
Cortisol is a hormone produced by the hypothalamic pituitary adrenal axis, starting in the brain, going down to the pituitary gland and the hypothalamus. And what happens is that it's response to stress. So when you have a stressful event, such as you're scared, and we see that your epinephrine goes up, which causes your blood pressure and heart rate to go up, and then the cortisol level will go up too. And the reason why that does is it gives you the, helps to give you the energy to deal with whatever you're going to deal with, whether it's run or whether it's fight.
Let me put it in simpler terms, because I think this is where people don't realize in their everyday life. I don't like my job, so I'm doing things, I hate being there. You're causing yourself stress.
Absolutely.
And I'll tell you where I'm going with this a little bit. You got to learn to find the good things and the positive things in what you do. Because if you're a negative person and you're not looking for the positive, you're creating stress. You're causing this to happen. And doesn't cortisol cause everybody's #1 complaint, belly fat?
Absolutely. And, you know, cortisol will cause deposition of fat in the abdominal area. Just look at people who unfortunately have to take cortisone for whether it's rheumatoid arthritis or some type of connective tissue disease, and they have to take cortisone to reduce the inflammation. And I'll get back to that in a second. So they take this cortisol to help reduce the inflammation in the joints or in skin for psoriasis or psoriatic arthritis. They take this cortisol all the time, but what happens is, you know, whenever you see someone who's on steroids a lot, their face is puffy, their belly's puffy, and they actually have a little bit of a hump in the back of their neck and their spine. And all these are the results of chronic use of steroids, unfortunately. So steroids will reduce inflammation, but they'll also cause other problems.
And there again, I think it goes back to, if everybody wants to find a pill to solve the problem, so use the pill as a temporary to get you through if it's a really bad, you know, if you're in a really bad state. But then start to adopt the healthier lifestyle elements that will put you on a path that will prevent you from having to need the medication, maybe, or as much of it over the long term.
Correct.
I think that's key. You've done a lot of studying on sleep, and sleep is a really important part of relaxation, because people think, okay, I go to bed, I have the television on, I have a light on, or I slept, or then blah blah blah. That's not good sleep, right?
No. And you know, the first thing I always tell people about sleep, if someone's complaint, and the usual complaint is, I don't sleep very well. Okay, so you have to think about what's going on in the bedroom. Is the TV on? Is there noise? Is there light coming in? Does the light come in early in the morning too quickly? And all these things have to do with sleep hygiene. You know, did you have a drink before you went to sleep? Did you have a cigarette before you went to sleep? You know, are you taking sleeping pills? Are you taking something over the counter for sleep? And a lot of these caffeinated beverages are absolutely the worst if you take it after 6 o'clock.
How about eating a high-fat meal or a big meal before you go to sleep?
Eating high-fat meals, same thing. All these different things can cause inflammatory changes. The lack of sleep can cause the buildup of the interleukin-6. Okay, so all these things, now you're back to those cytokines. And again, those have been measured in research models, but it's not something we normally or measure in people. But we can fix sleep hygiene. We can tell you, here's how you sleep. You know, don't use the bedroom for anything but sleep or sex. And that is a problem for people. If you're using it to work on your computer, you're using it to watch TV, then you're training your body to say, the bedroom can be used for anything. But if you tell it, it's just used for two things, sleep and sex, then it makes a difference for people.
And that is a very healthy approach.
Absolutely.
Is sleep apnea real?
Absolutely. Very common. Probably in the general population, it's about 5% of people. Now, if you think about, you know, over 200 million people in the country, that's pretty high.
Can you control it with, granted, I know you need the
CPAP.
CPAP? But if you lose weight, you adopt healthier lifestyle, get some exercise,
it can reduce the risk, or it can help actually reduce the problem that you have. if, for instance, you're kind of a borderline case, and you have to be on CPAP, because you stop breathing a certain amount of times at night, and then all of a sudden you lose 10% of your body weight, that will possibly put you over the edge to the point where you don't need the CPAP. Mm-hmm. So yeah, there is a big difference. Or it may cause you to if you go from, say, a pressure of 15 down to a pressure of 10, which is a big improvement.
Mm-hmm. And see, I think this is another great example. The medical profession has things to treat whatever your immediate ailment, illness, problem is. But treat it and also incorporate the healthier lifestyle for the long-term goal of significantly reducing the medication. Diabetics, sleep apnea, whatever it is. The pill should be, or whatever the medication or the treatment is, should be the temporary fix until you get the journey going and you have been into the healthier lifestyle long enough that now you're getting that residual effect and you don't need necessarily the medicine or the medical device.
So what you're saying is to incorporate healthy lifestyle changes,
yes,
before you get to that point.
Or
where you need the pills.
With. With.
Or
when you get to that point, you definitely need to go to your doctor, and you definitely may need the CPAP. You need your diabetic medication, but you may need this much of it when you start. While you're doing that, start to incorporate a healthier lifestyle so that the medication or the medical needs can maybe get to here. You can significantly reduce how much exterior medical help you need, and you can be healing your body from within and keeping it on a much healthier path.
Truer words were never spoken.
Yeah, and you know what?
And that's the whole thing with you teach medical students, residents. Adopt healthy lifestyles first, and then base everything else treatment-wise on what they do and the results of that healthy lifestyle.
People kill me because now there are medications for cholesterol, right? I don't ever have to worry about eating a healthy diet because I can just take a pill and it'll control my cholesterol. Really?
There you go.
I mean, there's always a I don't care what pill it is, there's a positive, but there's some negative that goes along with. That's no excuse to say, okay, I'm not going to exercise now and I'm not going to pay attention to my diet. You agree?
We live in a pill-popping society.
I know, I hate it. I hate it. Wow, number 3, foods critical for good health. And you cannot believe how bad the bad ones and what they're doing to you and how important some of the new information is on the good ones.
And again, I think we touched on a lot of these things, which is, adopting a low-fat diet, less than 30 grams of fat for the most part. The omegas, the omega-3, and what Dr. Roizen, in his discussion, he focused on the odd omegas, the omega-3, 5, 7, 9, and all the different types of foods that contain these types of minerals and vitamins. And I think that if we use his model, we get into things like fish and avocados.
And what's the new superfood?
And nuts.
Nuts are
Walnuts.
Walnut is the new superfood.
Absolutely.
And nuts is the category of the superfoods for 14.
And the walnuts reduce the utilization of carbohydrates. They reduce the simple sugars. They help to employ the fat content of certain meats, red meats, things like that. So if you're going to eat some of these bad things, incorporate the nuts. It's a handful of nuts. It's 6 walnuts.
Well, you know what else is great? Walnuts, you can crush them and add them to different recipes, add them to salads, add them to vegetables. They are so flavorful. People don't think of cooking with ground nuts. It's an awesome thing to add to a recipe.
And you're absolutely right about that. And we have to be cautious with some of the viewers who have things like diverticulosis.
Yeah, what do they do? The oils? The nut oils?
The nuts they tell people don't use a lot of nuts because they may get stuck in those little pouches, cause inflammation. But as you said, some of those nuts can be crushed and can be gotten to the point where maybe it doesn't cause that inflammation, that exacerbation of their diverticular disease. Or use the oils. I don't know that the oils do as much as the regular nuts, but perhaps they do.
And you can take your nuts and put them either into a coffee grinder and grind them. I use my coffee grinder and grind them really fine sometimes for certain things, you know.
Right.
And plus, I like to grind them really fine. A Mary tip, because then they go farther, right? So I have less nuts that go a lot farther. The bigger the chunk, the smaller they go. They don't quite, yeah. So I like to do
Saves some money.
Yeah, put a little water in the salad dressing to thin it a little bit. I have my little Maryisms that I've learned over the years. Pop, I can't emphasize to people enough. It does damage to the body, right?
Well, I mean,
I hate to say it.
Mayor Bloomberg fought this fight, for all the years while he was mayor of New York, and, talking about reducing the amount of these giant drinks that have 64 ounces of basically sugar.
Yes, exactly.
And, as a cause of people gaining weight, people being sluggish, increased incidence of diabetes. And I think that it is something that you have to think about. I'm not going to go as far as saying the things he said, get rid of it, make it illegal. I mean,
but moderation.
People have to be able to make a choice. Mm-hmm. And if you just give them the right information, perhaps they're going to make the right choice as far as reducing their intake of this type of simple sugar.
And the bad foods, I mean, there was literally a whole section at the conference, and it was called A Food-Based Approach for Controlling Inflammation. So, in summary, basically, a pro-inflammatory diet, anything that's definitely has the high fats, diet with the high glycemic index. Let's talk a little bit, because there's so much conversation today about glycemic foods, the high glycemic index.
Those are the things like the simple sugars, the pop, the syrups, things that even some carbohydrates that can be broken down very quickly in the body from carbohydrate to simple sugar. Those are the bad things.
White flour.
Yeah, they have
Instant.
high glycemic index.
Anything instant.
Correct.
Any processed and refined foods.
Correct.
And the things that are really, really low are things like beans, nuts, again, all our fruits and vegetables, the whole fruit and vegetable. Because when you drink the juice, I was having a discussion yesterday with a friend of mine, and we were talking about, she's juicing. And she was saying, how much, sugar do you think I'm really getting? I go, you're better off eating the fruit. Why? And I tell people, think about when you make orange juice. When you juice an orange, you get like this much juice. So to get a glass of orange juice, you probably need about 8 oranges, right?
Correct.
You eat an orange, you're only getting that much juice. You're getting all the sugar, no fiber in the water of 8 oranges. You eat the whole orange, you're full. You only get that much, enough of the juice, but you get the water, the fiber, much more, less sugar, much lower glycemic index response by eating the whole fruit.
Correct.
And we talked about dried fruit. Dried food is very condensed because it has more sugar. They take all the moisture out of it. So naturally, you're going to get a much higher sugar rush, a much higher insulin rush.
Right.
So think about eating, that's why I think if people remember eating whole, how did nature make it? And there's no pill, drink, or supplement, as I've always said, that's going to do for you what good, natural food, just the way God and nature make it, is going to do.
Correct.
I don't care what anybody says. We talked about food and inflammation. We talked about some of the stress and the cytokines. Let's talk a little bit about exercise, because one of our wows is extreme exercise may be causing more harm than good, right?
Yes, and I really think that this is a big wow. People believe there's a lot of things on TV where they push you to do this high-intensity exercise. And although high-intensity exercise is good, in a moderation, it's something that every day, if you do this high intensity exercise, and one of the things they mentioned was training for marathons. So doing this high intensity type of running is going to, really cause a lot of inflammation.
And doesn't it cause stress?
It causes stress, it causes inflammation. The breakdown of the muscles from the high intensity exercises causes a increase in this interleukin-6, one of the cytokines that's inflammatory marker, and it can also cause damage to muscles, damage to arteries. So you have to really be kind of cautious with this high intensity exercise. We're not saying don't do high intensity exercise, but if you're going to do it, you have to do it in moderation.
And I think we have gotten ourselves, even as a society, everybody's got to be going 100 miles an hour and everybody's got to be the best of everything. Now we've created, a half marathon wasn't enough, so now we have these marathons. And it's like, and then there's a bitter, depending on the weather and so on. I mean, some of that stuff for the average person, it's not the type of exercise that we talk about for a healthy and fit body. If that's something you want to tackle as a sport, but understand, that's not what we talk about as being a healthy and fit exercise routine for day-to-day living.
Right. I mean, we're talking about things like walking.
Yes.
What a great exercise.
Yes.
Weights,
resistance training.
You see people that have these little pedometers that they wear on their belt and they do 10,000 steps a day. It really helps. It really improves muscles, it improves your blood flow, it reduces your blood pressure, and it's just a simple thing that you're doing is walking. And you're not running, you're not jogging, you're not running a marathon, you're not doing sprints, you're not doing anything high intensity. And it's the high intensity stuff that you do day in, day out, that's going to eventually be bad for you.
You brought up pedometers, really critical, and I've said it on other shows. It was a very eye-opener for me, and I'll tell you why, very much an eye-opener. I would think with my exercise routine, even my day-to-day living, 10,000 steps was a no-brainer. In our area, we're in a suburb, we're not in a really warm climate where you're outside all the time. You drive everywhere, you don't walk as if you were in a city, right? On the days I'm not running, and I run on a treadmill, and I have, by the way, I'm a good example because I reduced my running from 60 minutes to 50. I used to run, like a 7-8 minute mile. I now ease into a 10-minute mile and I stay there for about, 30 minutes. But I have definitely, which is good for me, I monitor my heart rate. But I have definitely, I would say, cut back on my intensity and I feel great. I'm getting I'm getting better results. But, the key is understanding your body, your fitness level, and then organizing your fitness routine to you, not to everybody else that's out there.
Correct.
The conference and what you walked away with was maximize the benefit of your individual exercise program by matching your fitness capability, your temperament, and designing a program to achieve your body's goals. And you have to consider your age, your physical health, and your preferred activities, because if you do things you really hate, you're not going to stick to them.
Correct.
And I think when you talk about age and physical fitness, you can improve it, but you need to know where you are today, and you can set goals of where you want to go. But you just can't, go out there and think you're going to keep up with somebody who's been doing something for a really long time. And even if you're a fit person like me in many ways, when I start a new something, like yoga and Tai Chi, I love yoga, but I'm not nearly as good at it as I should be. But it's difficult for me. I mean, I'm not nearly, as poised and elegant as I am, for example, at Pilates that I've been doing now for, 10, 12 years. It's an interesting balance. We're talking about the pedometer. I want to get back to that because what I started to say was people will be amazed. 10,000 steps a day is what we should be doing. I'll bet you there are people out there that think they're doing maybe 5. I bet you they're not doing 1,000. It's hard. It
Right.
really is hard in our environment. So you need to understand your environment and figure out, schedule that activity. Get that walk in there. Whatever it's, march in front of the TV. Put the pedometer on. Get those legs moving. That's walking. That's moving.
I've noticed that my brother does that all the time, and I noticed that he'll do that and he'll walk around the house.
Oh, yeah.
And he'll
It's
just, you know,
excellent.
whether he has to make a phone call or whatever, he still walks around the house,
Absolutely.
up and down the steps.
Yep. So I think in closing, our 4 wows will summarize. I don't know if there's anything special. Inflammation is critical. Pay attention to it. Are your eyes puffy? Do you have rashes? Do you have eczema? Do you have psoriasis? You know, are you bloated? Are you swollen? Illness means inflammation's going on somewhere, right?
Correct.
What about like your glands? Inflammation if you have swollen glands?
Sure, if you have swollen glands, could mean a couple of different things. Could mean infection, could mean inflammation, could be a response to a virus, sinus drainage, you know, things like that. Persistent lymph node swelling is something that needs to be looked at.
Get it checked.
Yes.
You know, puffy, I tell people, look in the mirror. Really give yourself, strip down, look in the mirror. What do you look like? And look for signs. Do you have big, puffy, you know, dark circles under your eyes? Do you have a lot of puffiness? You know, do you have a lot of belly bloat? Do you have, I mean, look at yourself. Number 1. Number 2, lifestyle matters. You know, pay attention. If you're, you know, you've got to get the stress under control, number 1, then you got to look at, are you smoking? And if so, you know, cigarettes have to go. If you're enjoying a cigar occasionally, you know, balance. Food and beverage choices. Physical activity. What are you doing? Take control of your health.
Correct.
You know?
Because as we said before, all of those things cost 75% of all the hospital costs
Yes.
and doctor costs that we see in the U.S.
And, you know, that's like I said, people are the greatest master of their health. And you got it, you know, it's balance, balance, balance. And moderation.
Correct.
You cannot believe how important, like I said, your choices are in controlling information and your supplements. You want to look at what's, you know, a good multivitamin, depending on your age. We're talking a lot now about DHA, about vitamin D, because we live in a climate where we're not getting a lot of sun. Check with your doctor before you take any supplements. You like that?
Absolutely, because they can easily measure your vitamin D level and let you know whether you're getting enough or not. Most people, I think one study that was done in Ohio showed that 85% of the people were at the low end of normal or below normal in vitamin D3 level. And you want to shoot for a level of like between 40 or 50 and 70, and a lot of people are running 30 or below. So you're probably going to need supplement for vitamin D3.
And I like, you know, take your supplements with food, but look at them as to supplement what you're not getting in your diet, or what you're not getting enough of between your diet and your, you know, environment of where you are and where you live. And I think, you know, it's not just about the vitamins. It's about now some of the healthy fats. Like, look at your omegas, right? We're getting a lot of omega-3. Are we getting a little 5? Are we getting a little 7? Are we getting a little 9? Are we getting a 6? 6 is really, you know, important.
Right. I think we need to look at a lot of these different things. Unfortunately, it's not something that we normally measure. Although there are some lab protocols that will do a measure of a lot of these minerals and supplements that are taken, and they'll actually measure them if you ask your doctor. They can have you go to a lab that will measure a lot of these things.
And I always like to tell people, check with your doctor, because a supplement can interfere with the medication that you're on. So you want to make sure your physician knows
that they know what you're taking.
But like I said, the cutting edge wow. Start to talk to your doctor about these omegas. Are you getting enough? You know, look beyond just omega-3. Really focus on omega-6.
Correct.
Your nuts and seeds are going to, you know, fix a lot of that problem. And exercise, you know, like I said, getting into balance. One other thing I want to touch on, because people, the hardest thing for me, especially with women, they want to get on that treadmill, or they want to get on that elliptical. They just want to be like the gerbil. No, I'm telling them, cut back on that a little bit. You need it, but you've got to have resistance training, and you've got to have some type of a stretching relaxation. You've got to be practicing yoga, practice Tai Chi, practice meditation. Meditation is so important to good health.
Correct.
And and when we think about our daily lifestyle too, even a family situations get stressful. Maybe you have young children, or maybe you have teenagers, or maybe you're having an argument with your spouse or your significant other, or whomever it may be. Sometimes take a break, take a step back, go to a quiet place, take some deep breaths, close your eyes, meditate, calm that stress. Don't keep going back and forth and, just throwing words at each other and fighting. Calm it, because you're creating a lot more havoc in your body than you even realize.
Correct.
Plus, you're probably not going to solve the argument while both of you were in that state of mind anyway.
Probably
so
not.
It always makes more sense when one can step back and gather their thoughts.
Take a step back, relax, and then come back with a clear mind.
Absolutely. Dr. Lileas, as always, invaluable information. Thank you, thank you, thank you, and thank you. I know you put so much time in. Like I said, there's so much more. We may ask you to come back and go to level 2 about all this information and get to WOWs maybe 5, 6, 7, and 8.
Very good.
All right, thank you so much. Thank you for watching. I'm Mary Pipino, and this is Fit for You.